Neoplasia, chapter 7. Neoplasia means new growth. Obviously, growth of the tumor could be malignant, could be benign. I need to tell that somebody don't know how to spell benign. I'm pretty sure that some of that person is here right now. I make that observation. Good for you, Mabel. Good for you. I like that kind of spirit. It's painful to see it, but it's true. But don't worry. Again, I will cut some of the things, and some of the things probably I will ask them later in the midterm. I will tell you that in the review for the midterm. Right now, these definitions on neoplasia, somebody see it. And the reason for that is because we are talking about cancer over here. Okay? Now, in the in-class assignment, some of you, we will see the difference between malignant and benign tumor. Meaning, please, even that I probably will not ask you this one in the quiz, in the in-class assignment, there is a question about the difference between malignant and benign. If I let you to use all the books, all the PowerPoint to use it in the in-class assignment, please don't put just one different. You have plenty over there, and you can look for more in the book. Meaning, careful with this one in the in-class. All right. The benign, that is the big difference over there. Also, well, malignant. Malignant grows rapidly, initiate tumor vessel growth, and frequently necrotic and dysfunctional. One way to guide you how bad is a cancer is this. When they do the biopsy, every cancer have an origin from any particular tissue. For example, a cancer in the bones, obviously, those tumors will have some kind of characteristics similar to the bone. Okay? So you have a tumor in your muscle, those particular, exactly, tumor markers. But in this case, the aggressivity, or more aggressive the cancer is, less that tumor look to his original tissue parent. Even that we know that come from the bones, more different that tumor looks to the original tissue, more aggressive will be that cancer. And that is what we need to be careful. That's why when these two big differentiate over there, is an aggressive cancer. More similar the cancer is to the original tissue, more probably opportunity we have to fight the cancer and eliminate that tumor out of the way. But less differentiate that cancer is from the original tissue, we will have a huge fight against that cancer. Okay? That is the hint, meaning less similarities to the original tissue, more aggressive the cancer is. Now, careful with this difference between malignant and the next one, benign tumor, because you will do it in the in-class. That is the first thing that we are doing this week. You have more about benign tumor over there. The most important thing is, and you need to remember, since benign, exactly with that, do not have the potential to kill the host. Crystal, which session you are? You need to tell me which session because I don't recall which session you belong to. Remember that is the big difference between the malignant. Okay, Monday and Tuesdays in the Tuesday in the night, meaning that on Monday you will have your quiz and you're in class because it's when we have 2 hours. Okay, remember for my classes on Monday, your quizzes will be on Mondays. The only exception will be the holiday that we have in February, that I will do those quizzes on Tuesday or Wednesday, because the class on Monday will take the class then on Wednesday. Capisci? Just to keep in mind that, but that is for the holiday. I will let you know exactly, because in President Day, those that take the test on Monday, I will move them for Tuesday in the class of the evening, or for Wednesday for the class of the Monday and Wednesday. Okay? But we talk about more about that later. Now, careful with this one, and also I include this one in the in class because it's part of that difference between the benign and malignant. You have a terminology over here. Sometimes, by the way, I have something like a true or false with this because oma, like adenoma, signify benign tumor. But everything that is in carcinoma or sarcoma is already malignant. And probably I will do that. There is a multiple choice, one of four, asking you about what kind of tumor do you think it is? It is malignant or it is benign. Capiche? Careful with that. Just to differentiate between carcinoma or benign over there like an adenoma. The next one is basically some exception to that one because these ones are all malignant, but I will not enter in this one yet, just with the previous one, meaning that this one is out. Now we have a malignant phenotype. I will not ask you with this one because I need to explain something in another chapter. Yes, no problem. All of these fellows, all of these tumors, all of them are malignant. Okay? I'm sorry, Castillo. What is the question? Omas. The previous one, yes. I have a question, this one, to differentiate. I will put over there the name of the tumor, and you will need to tell me is it benign or is it malignant. That one in particular, to differentiate between these two. So you know that ends in carcinoma sarcoma, you are in front of a malignant tumor. So you don't see those wording over there, it's because you are in front of a benign tumor, okay? Basically, and it's a multiple choice. I think pretty sure the 2 or 4. Okay, moving on. I said this one is out, and this one, exactly what I mentioned over there. I will basically discuss this one in the midterm. No, now. I want to go a little bit further, but in the midterm, because this is a huge multiple choice that include all this part and with the next one. But I will not do this question right now. The next question, yes. One of the things that's sorry for the nurses to be that they like to ask you in all these particular tests is some kind of epidemiology and some factor, meaning there is a multiple choice regarding this one, but it's just one test of 4, meaning multiple choice, exactly like that. I did a copy paste. Everything is true about the epidemiology and risk factor except I will change something over there, okay? A, B, C, D, all of the above, or none of the above. Moving on over here, this one is out because I will ask about this several times later on. That's why I have the luxury not to see it now because we'll see it again later. One of the things that you will see also later is the tobacco use. Obviously, that is our enemy number one. The death rate from the lung cancer has dramatically increased, may be directly related to smoking, and you have all the problems over there with lung cancer, and tobacco also linked to pancreatic, kidney, bladder, and all the other cancers over there. Meaning, I will not ask you this one now, but I will ask you this one later. Meaning, I will put it out for the moment. Interesting to notice all these carcinogens that the tobacco have. Many people know this one already, but I will put this one out for the moment. Now, this one is important for me because I will ask some definitions about these particular fellows. What is a tumor suppressor gene? What is an oncogene? What is a proto-oncogene? And carcinogen, potential cancer-causing agent. Those definitions, please, careful. I have true or false with them in the quiz. Some of you will see it. This is 2 or 4 in the quizzes. The proto-oncogene, I will not ask you directly, but this is the gene, normal cellular gene that can transform into oncogenes. If they transform in oncogenes, it's because that cell is having a mutation and became a cancer cell, okay? Normally a cancer cell avoid to follow instruction. Like some students of mine that you make the instruction several times and they don't follow instruction, they became cancer cells. Yes, because they drain. Now, just kidding. Again, I will not ask you for this one, just with the previous one, because we will see this again. Now, careful with mutation. Mutation leads to excessive responsiveness by expressions of the receptors that should not be there at all, excessive amounts of normally present receptor, and receptor with a normally high affinity. Careful with, yeah, I will explain more in the class in other chapter later, but at least what the mutations do to the cell in this particular line is important for me, okay? The signaling over here, the chemical signal, I decide to remove this one out. But you ready over here to have something important that gene mutation can lead to cancer. You see over here, I will discuss this later, but again, I can do only 30 questions. I cannot do 100. That's why I need to read this one for now. Now, keep in mind that we also have transcription factor. Another kind of gene mutation can lead to cancer over there. I not ask you this by the moment. Most of the proteins that create this kind of problem is because are abnormal proteins as a consequence of the abnormal genes that are encoding those proteins with, I would say, with the wrong information. But again, this is huge amounts of microbiology and genetics over there, genetics, and that's why I don't want to enter right now. Now, careful with this definition. That will help you out with the proto-oncogenes. Become active oncogenes when the mutation alters their activity, so they proliferate, they start to multiply without control, promoting signal generated inappropriately over there. Also, somebody will see this one as a multiple choice, 104. Proto-oncogenes introduced on the whole by the retrovirus. This is something that I like to share. Yes, that is correct. The previous one and this one is part of the question. What something that I discovered, and this is very interesting, in my practice before I close my office over there, is that a lot of persons that basically don't have any particular allergies, suddenly they start to show up allergies to seafood and other environmental factors. I decided to move and look back in the medical record what they have in common, the majority of these patients. I discovered something very interesting. All of these patients that suddenly start to show up with some particular allergies that they never had before, they are basically exposed to cold viruses or flu viruses. The only thing that I thought immediately is that those flu viruses are basically introducing some particular genes or alterations to the genes to the immune systems of this person, and now predispose this person to allergies. Probably another person from Harvard would make this more or less the same assumption that I did right now, and he will be famous. I am still teaching in West Coast. Show the slides again, the previous one. Okay. This one over here. Okay, careful with this one. 25 and 26 is part of the multiple choice. Now, moving on over there, remember, error in the chromosome replication can create another copy of proto-oncogene that will reinforce the mutation inside of the cell and obviously the transformations of the cell. Moving on. Now, particular virus we know and we recognize in medicine and in science that they can transform a normal cell in a cancer cell, you have them over there. All of these particular viruses are capable to transform normal cells in a cancer cell. Remember that we already mentioned the famous HPV that can do that in the cervical cancer and also cancer in the throat, meaning that this particular need to be careful when the person is basically exposed to these particular viruses, especially if he's immunocompetent, okay? But again, I will not ask you this one for now. I will not ask you this one for now. For more that I want to ask you this one because I love this part of the material. But again, I have already enough to cover. This one, for more pain that I need to say no, I need to say no because I don't have a space in the test for this question. But oh yes, I want this one. Important question in the quiz. I think 3 or 4 we see this question. You see over here that in a normal cell we have a code breaker. A code breaker is somebody that will keep the cell in check, and when the cell start to do something that don't supposed to be doing, this gene immediately activate and put the cell back in track. This particular gene is what we call the master break because when the cells start to multiply beyond that they're supposed to be, they will stop the cell division. Remember that a cancer cell is not just a group of cells that start to multiply or control, meaning that this gene is the responsible to keep the cells in track when they start to multiply. It's obvious the cancer cell have an alteration in that gene because they continue multiplying. Meaning, careful with this one, and this slide include the next one. That is part of that question. Okay? If you inactivate that gene, obviously the cancer cell will continue multiplying without control. The other important gene in this category is the famous P53. This is VIP question because I will ask you this one in 3 or 4 quizzes. It's a multiple choice. Most common tumor suppressor gene defect identified in cancer cell, meaning this is a gene that in the normal way will protect you that the cell transform in a cancer cell. But when this particular gene have a mutation, don't follow the proper rules and let the cell continue multiplying over there. As you see over here, normally P53 inhibit the cell cycling, accumulate only after cellular DNA damage, bind to the damage of DNA, and stop the division. That is important when there is some replications inside of the cell. When the cell divides, they need to have identical information, both cells. If for some reason that divisions of the cell make a mutation and one cell have more information or defective information more than the other, that can initiate a cancer cell. That's why this particular gene keep a control that the information that all the cells possess is the same. Meaning that it's a VIP 3 or 4 in the question, and this particular slide continue with the next one, also included in that question. Okay? Meaning careful with this one, is part of the previous one, VIP 3 or 4, because it's one big question. Then the other genes that many people already know, the famous BRCA1 and BRCA2. I will not ask you this one in the quiz because most of us already know what happened with these quizzes. Could be many things. Could be many things. Could be the apparitions of a virus infecting the cells and altering the genome of the cell. Could be an exposition to radiation, could be an exposition to medication, poison, could be many things over there. Meaning that why a cancer cell became a cancer cell is a huge alphabet probabilities over there. Now, what something is clear for all of you, because, and this has happened, and we have this conversation sometimes even in the hospital. Why Gaston go to Walmart and he take that hamburger and he never became sick, but Nurka went and became with diarrhea to the next day? Even that is the same hamburger, even that eating bread. Probably is genetics. That is correct, Hooper. And not only that, is the capacity that probably the human host have to repair the damage or to amend the mistake when they see that virus coming that way. Many people probably don't have the tools to repair quickly that particular damage, and that's why they became predisposed. That is basically what we discuss behind doors, sometimes in the hospital, I say, because not make any sense that this particular source of food is contaminated with something. Some people became sick, other people stay healthy, and some people could die, and other people continue like nothing. There is something in the genomes that are protecting these people particular diseases. And other people probably are too predisposed because they don't have the mechanisms of repair. That is what we suspect. Now, to prove it, that is another price. Okay? But you already have an idea, meaning, what is my advice to all of you? If you recognize that in your family have this particular often diseases of the immunologic origin, care for yourself. Because that means that in your family, something going on over there that can make to predispose a high risk to the diseases. There you go, higher risk. That is correct. But again, sometimes it's to win a lottery. You don't know who is the person that will bring out a problem times. Okay, moving on. See, the topic is very interesting. Now, how are the steps in the carcinogenesis? I have a particular question in a multiple choice that will ask you exactly for this. Initiation, promotion, and progression. I like to change and switch those wording because that is the step how the cancer became cancer. You have an initiation, sorry over here, initiation, you have a promotion, and you have a progression. Over here is the first step. I will not ask you the step by step. I'll ask you in general what are the three steps, meaning this is what you need to remember. Okay? I wish to ask you more, but the time and what we have in front, we don't have the luxury for more. Okay? Now, you see over here, so you want to know more, I will not ask you for this, sadly for me. Initiation, I cannot ask you for this, and believe me, I love this topic. I love this topic because you want to comprehend how the cancer cell can do what they can do, and you'll be amazed. The promotion, I cannot ask you this. This is another part of the promotion. You see over here how the cancer cell produce the telomerase over there, or the telomeres over there, that will keep them multiplying forever. More telomerase this particular cell possessing their chromosome, more continue, they will continue living and dividing forever over there. What is interesting for some of the people that don't know this, a cancer cell in a person that's healthy, I will say this one to everybody right now that is listening to me. Any now and then, one of your cells in your body misbehave and became a cancer cell. The reason why you don't have a tumor is because your immune system is so competent that identify that tiny bastard and destroy it. But a person that is incompetent don't have that luxury. And that's why the cancer cell take abuse. But don't be surprised that now and then in your life, you will see people saying, hey, we find something funny in your body, but you don't have anything else anymore. Your immune system responds to it. Okay? All right. Let's move to the next one again. I will not go through this one. Progression. I will not go to that. You see, we already reached the half of the chapter basically. See the progress to the malignant characteristic, all those receptors that start to show up, some enzyme to destroy the environment around them, the bizarre karyotype that these cells develop. The cancer cells are so intelligent that every normal cell have protein that identify that belong to your body from something that is a foreign in your body. And when the white blood cells approach to them, the cancer cell, what they do is to hide that protein and don't allow it to be recognized by the immune system. Imagine how smart these fellows are. Moving on over here. Now, metastasis, I need to ask you this. There is 2 questions of 4 about this. Very important for me because I will ask about this one several times, even in the midterm. No, the previous one is out. Process by the which the cancer cell escapes their tissue of origin and initiate new colonies and cancer in distant site. That is the problem with the cancer patient. Even that we remove the tumor or the primary tumor, what you need is only one cell that escape that particular removal of that tumor. That is the reason why we call these patients in remission, because we know that in the long run, something else will show up. And when you have a person that will remove the tumor, we will need to be behind them up to almost 5 to 10 years to make sure that particular tumor don't show back again. Sadly for us, sometimes we have patients with tumors, for example, in the breast, that we catch them on time or think that we catch them on time, but 5 years in the row we discovered that the tumor came back and now it's in the liver or in the lungs or in the brain, and that is something that we cannot foresee in this particular patient, but that could happen. And the problem is, sadly for this patient, even that in the first, I would say, fight that we can remove by chemotherapy, radiotherapy, and kill the primary tumor, when the tumor show up again, now it's more aggressive and sometimes it's a little bit unresponsive to the treatment. It's another problem that we have. But again, careful with this multiple choice, and also careful with the pattern of the spread, multiple choice. Okay? The pattern of spread, that is how the cancer basically move away from the original site and start to invade other organs. You see over there the tumor markings, Moodley mentioned before, that identify the tissue. That is the way how to know from where that cancer is coming in your body. So you have a tumor, for example, in your shoulder, if that tumor have the origin there, or it's because it's coming from other parts of the body. Okay, that is the idea. Now, this particular PowerPoint also includes the next one. That is part of the spread. Very important for me that you know that. I create a huge multiple choice in those particular one. Tumor marker, how to identify the parent tissues and cancer origin. Now, a freebie. This is a multiple choice. Almost everybody will see this one. 404, exactly like that. Exactly like that. It's a multiple choice. Angiogenesis. Everything is true about this, except I will change something. I don't know what it is, but I change something. Every test will have something different because I also have everything is true except and select all of the apply, even that is the same question. But this question, everybody will see it. I will jump my question, and then you have the grading and the stagings of the tumor. I will not ask you for this, but it's exactly what I was mentioned before. Greater the degrees of the differentiation from the original tumor, greater the degree of malignant potentials over there. The slide 47. Well, I am in 42. 47 is a question. I will not go with a question. That is out. I show you this one to give you an idea exactly what I mentioned over there, but I will. You see, I can change it for some reason. Okay, the staging. Careful with this one. Somebody will see this one as a multiple choice, 104. This one is very important for all of you because you will work with this one in the core. There is one question, sadly for me, I cannot ask for more, but I am thinking that I would include this one in the midterm again. But 104 at this moment, you need to know how is basically the grading of this tumor. More nodes involved, more spreading from the original area, more problematic for us to fight that tumor over there. Then the effects of cancer in the body, more or less everybody have an idea because more or less you know how the cancer basically little by little will be destroying that body. I will have some other surprises, but I don't want to throw out all of them right now. That's why I will put a little bit later. with some pictures and some particular stories, meaning I will remove this one out, remove this one out, but you have the warning signs of cancer. We have many, many signs depending what is the cancer type over there. You see this warning signs in children. I don't like to touch those topics right now because some people became a little bit sensitive. That's why I will not go with this one right now. But more or less everybody have an idea when they have something over there that don't belong to. It's very important that when you have a tiny mass that is painless or a nodule that is painless and they don't want to move in your skin, to do a biopsy of that right away, because normally many people became a little bit scared when they have some kind of nodule or some kind of overgrowth somewhere. But since that is painful, it's probably a localized infection or a lymphatic nodule over there. But since it's painless and it start to grow, start to make a biopsy, you never know what you can find because early better. Now, pain, believe it or not, that is one of my beautiful topics, pain. I like to create pain, but I will go with this one right now because we will discuss pain later. Cachexia, very indeed. I will ask you this one later, no now. I normally do it in the midterm. Sadly for us, even in the medical community, we don't tend to identify a patient in cachexia. That weight loss, that generalized weakness is a problem. Basically like that. Well, cachexia will make you reach over there. I'm pretty sure you will reach over there. But go, it's still a lot to go over there. Now, careful with cachexia only. This is the one that I will go right now. No, I will not go with anything else. The bone marrow suppression, I will not go with this one because we will see this one later in another chapter. The thing with leukopenia, don't worry about this. We will go through these fellows again. The same happens with this one. Thrombocytopenia. I always emphasize we are students to remember the normal values of every particular white blood cells or red blood cells in the body. That is important, including the platelets over there, because this is how you need to react when you see those CBCs and those analyses. But right now, this is not the topic of the quiz for this one. I will tell you when. You have the cancer therapy. Remember, early detection is the best prognosis for cure. I don't need to tell you that and remind you that, but I will not ask you for this now. Surgery, obviously, one basically part of the arsenal when we are treating this particular tumor. I remember in one particular occasion, a person that basically have a colon cancer, the tumor was removed. They did a colostomy, and then after a couple of months, they need to reattach the colon back to the extreme that they removed. And they opened the lady, they discovered that the tumor is still there. Was a surprise even for the surgeon in that particular moment. And I was in that surgery. I don't want to remind you the faces of everybody to say, well, who will tell to this patient that the tumor is still there? Nobody know how to explain that to the patient when she wake up from the surgery. But again, I will not ask you this. Radiation, this is what the radiations do, damage the nuclear DNA of the cancer cell, but there is a problem. To kill a cancer cell with radiation or chemotherapy, we need to kill it in a particular cell cycle. If the cell is not in that particular cell cycle of cell division, the chemotherapy and radiation will not work. And the problem is, with so many cells over there, you already know that one of these cells probably will not be in the particular cycle that I want to kill it. And that's the reason why we need to apply small doses of radiation constantly, waiting and see if we can kill them when they reach to that particular cycle that we want to. Okay? But again, I will not ask you this. In the end, drug therapy, we have plenty of drug therapy. Sadly for us, so this drug therapy sometimes is bad for the patient. The falling of the hair. Exactly. That is another problem too. One the show over there that the good, the bad, and the ugly died. The bad cells, the good cell. Normally, we need to make sure the patient, when they are submitted to chemotherapy, have the enough stamina in health condition to hold the chemotherapy, because sometimes the remedy tend to be worse than the disease itself. Like, remember that this person don't want to eat, they feel weak, and those kinds of things that happens to them. Okay, but again, I will not ask you this one. Welcome. Most affected are cells. Remember, several causes ensure all cancer cells are killed. Serious side effect, bone marrow suppression. For example, in the case of the leukemias, one of the ways to try to help the patient is to kill the bone marrow that is created these weird cells in this particular person. And as soon we kill the bone marrow, we kill all the cells of their body, and then we do bone marrow transplant to this patient. The problem is that if the person is not compatible, they will die right there. The problem with this situation. Again, with this, you have famous immunotherapy that I will say that this is giving a lot of promise in recent years. I am amazed what they are trying to find and they are doing with this. For example, the famous monoclonal antibodies. And if you want to know more, look for chimeras or chimeric white blood cells. Chimeric or chimeras, an interesting topic that are coming in these days, is part of the immunotherapy. Explain very quickly because I know that some of you are a little bit tired. They are white blood cells from your own body. Then I put those white blood cells to grow. No, 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 Maria, no in the quiz. I will take your white blood cells, I put them to grow in a petri dish, and then I will use a virus. Sometimes they use even the HIV virus. They remove the genes that make the HIV virus pathogenic, and they remove that particular gene and they introduce another gene inside of this HIV virus that will be introduced inside of these white blood cells to your body. That change in your white blood cells made them to recognize the cancer cell and became very aggressive against the cancer cell. Once that these introductions of these genes, white blood cells, is done, they reintroduce those white blood cells inside of that human host. What happens next is, in the next 24 hours, all those white blood cells that they basically change in response to this, I would say, therapy, will kill every cancer cell that they encounter. And there is some interesting situation in when the person in stage 4 of lung cancer became immune against that cancer. There is a case that happens like that. The guy basically loses his hope of life because the cancer already consumed all part of the lungs, and they decide to go and try this particular trial, and he submit himself against this therapy. It's the first case in human history that we have a person that became immune against lung cancer. There, you can find on internet because the story is very interesting, meaning that we are seeing a couple of things that are advancing with science. Again, I will not ask you this one right now, even that later on I will ask you about interferons and interleukins, but not now. Gene and molecular therapy, you having over there some topics over there, may have high therapeutic potential, used to suppress overreactive oncogenes and may replenish missing tumor suppressor, but again, no. The current uses of this genetic alterations of the immune cells make them more efficient to kill the tumor cells. That is what we are trying to do, but not in the quiz. Not in the quiz. And reaching over there, the stem cell transplantation, obviously, that is one of the last resources on time. The problem is we have, I would say, bad outcomes sometime because there is not a compatibility with the human host, and we need to have a good donor for this. But again, I will not ask you for this because we will see something like that and the need of the donor for this particular thing. And believe it or not, this is the last one because what is at the end of the chapter is a case study that you can study by yourself if you want to and help you out more or less with the discussion. But until there is the chapter number 7, and we are done with the review of the night. I will stop the